Good morning to all. On behalf of St. Peter Institute of Pharmaceutical Sciences, I, P. Sujata, Assistant Professor, Department of Pharmacognosy, welcome you all for this one-day webinar on Ayurvedic research and future perspectives. Nowadays, Ayurveda changing our modern lifestyle and health-oriented habits with ancient wisdom of using herbal medicine to help us healthy, happy, stress-free, and disease-free life. Before we begin, let's have a look at our college AV. This is the 75th year of Pharmacy Council of India Act. As a tribute to PCI, St. Peter's have prepared the following AV. Let's have a look at the video. I would like to request our principal, Dr. P. Rajshekar sir, to deliver the welcome address.
Good morning, everyone. On the eve of Ayurveda Day celebrations 2022, St. Peter's Institute of Pharmaceutical Sciences is running a webinar, Ayurvedic Research and Future Perspectives. And I congratulate all the organizers for making it happen. And as a chain of continuous webinars, we have in our St. Peter's Institute of Pharmaceutical Sciences, I, Dr. P. Rajshekar, on behalf of St. Peter's, welcome you all. So we know Ayurveda is like an ancient medicine, and traditionally it is connected to our own roots. India has been an example of providing the best kind of medicine, which not just treats the disease but also prevents them from occurring. So Ayurveda runs on the basic phenomena called Ati Sarvatra Varjayat, means anything in excess is poison. And meanwhile, also they have a control on the poison in such a way that even a poison can be a remedy if it is like given in a particular proportion. So Ayurvedam is not just a medicine which is like belonging to the ancient time, but also it's applicable even in the modern times as well, because the stress-induced lives and whatever we have, the ailments nowadays are mostly connected to the improper daily lifestyle and also improper food intake and the job and occupational based stress, and all these things are well addressed in from ancient times as well in India with the help of Ayurveda. The Ayurveda itself says it is a science of well-being. Ayush is like life, and Veda is like science. So it's a science of life, and it controls all kind of ailments in three kinds and three states of kinds, where it is in the diagnosis purpose, prophylactic purpose, as well as therapeutic purpose. It is good at preventing the so-called diseases or detecting the diseases as well as in treatment of diseases. So it will be a great limelight thrown onto Ayurveda today on the eve of Ayurveda Day celebrations. And I welcome Kalpana Gajala, Associate Professor, Department of Pharmacognosy, RPBRR College of Pharmacy, Hyderabad, and also Dr. D. Santosha, Associate Professor, Department of Pharmacognosy, Vishnu Institute of Pharmaceutical Education and Research. Right now, I send a message of learning through this webinar, and I ask the organizer to take this event further. Thank you.
Thank you, sir. Now I welcome Mrs. Sweta, Assistant Professor, Department of Pharmacognosy, Organizing Secretary, to spell out about the webinar.
Good morning to all. Myself Sweta, Assistant Professor from the Department of Pharmacognosy. It's my pleasure to greet on this occasion one-day webinar on Ayurvedic research and future perspectives. So this webinar has been organized to explore the importance of Ayurveda in modern lifestyle and also current and future status of Ayurvedic research. So now it's time to welcome our first speaker, Dr. Santosha Madam, into the session. Welcome, ma'am. And Dr. Santosha ma'am is currently working as an assistant professor in the Department of Pharmacognosy from Vishnu Institute of Pharmaceutical Education and Research, Hyderabad. She has 12 years of experience in research and academics. She has completed her PhD from JNTU, Hyderabad, and she has received Women Scientist Activity Award and also acts as a co-investigator for a SCSP ongoing project from DST. She has published over 22 research papers in various national and international journals, and 3 books got published. So, with this brief introduction, I welcome Dr. Santosha ma'am to deliver a talk on Ayurveda research, status, and future. So, I request ma'am to take over the session. Madam is not audible.
Madam, Santosha madam, unmute.
Madam is not audible.
Okay, sorry. Thank you for introducing, ma'am. I would like to extend my thanks to the staff and management of St. Peter's Institute of Pharmaceutical Sciences, and then happy Ayurvedic Day, because any department of pharmacy is directly related to this one, because Ayurveda is the basic for the diagnosis and treatment, and our pharmacy is has emerged from Ayurveda itself. So let me share my slide. I am going to talk about Ayurveda research, present and future prospects. Okay, I'm Dr. Santosha, working in Vishnu Institute of Pharmaceutical Education and Research, and I'm here to talk about Ayurvedic research, present and future prospects. First of all, what is Ayurveda? Already everybody knows what is Ayurveda, but just a glance about Ayurveda. It is a science of life with a holistic approach to health and personalized medicine. It is one of the oldest medical systems which
Madam,
comprises thousands of
Santosha
medical.
madam,
Ma'am,
put in slideshow. Slideshow.
I'm sharing already slideshow.
No, madam. Once second. Full screen.
It's full screen, ma'am, for me. Can you see the slide now?
Yes, ma'am.
Now, ma'am?
Okay. Okay, madam. Continue.
Okay. First of all, it's about Ayurveda, which is the science of life with a holistic approach to health and personalized medicine. It's one of the oldest medical systems, as we all know. It comprises of thousands of medical concepts and hypotheses. Interestingly, Ayurveda has ability to treat many chronic diseases such as cancer, diabetes, arthritis, and asthma, which are untreatable in allopathic system of medicine. And also it prevents some side effects, like unlike allopathic medicines, it is devoid of side effects. If we talk about Ayurvedic research, due to the lack of scientific validation or due to the lack of standardization techniques, this precious gift from our ancestors is not being used as it has to use. Hence, evidence based research is highly needed for global recognition and acceptance of Ayurveda, which needs further advancements in the research methodology. Research should be a process that converts data into information, information into knowledge, and knowledge into wisdom. It should be more balanced and comprehensive. There should be an equal emphasis on literary, field, experimental, and clinical research. It should be able to impact the fields of education, pharmacy, and practice in a profound way. But Ayurvedic researchers are failing in this regard because the knowledge which is obtained from the traditional Ayurvedic practitioners is not being spread to the world because it is not being documented. The reason could be lack of trust in the Ayurvedic practitioners or lack of availability of the documented proof, or say it is not being transferred from the older generation to the younger generations.
Santosha,
So
ma'am.
because,
Slides
ma'am,
are not changed. Slides are not changed. Once check it.
now,
Only first slide, madam. The topics.
okay, I have changed actually. I don't know what's the issue here. Is it okay, ma'am? Can you see the
Ah,
slide now?
yes, madam. Okay.
Or shall I keep it as it is because slideshow, I don't think it is working here.
Okay, madam.
Okay. Then, also another reason for this one is the research work which is being carried out in Ayurveda has to be published in the peer-reviewed journals, and these journals has become impact factor journals, Web of Science journals, and Scopus Index journals now. So, comparative to other pharmaceutical journals, we have very less number of Ayurvedic journals, and also work which has been done has to be authenticated to be published in these kind of journals. So that is also one issue, and documentation and publication of the research findings is the main issue which is faced by Ayurveda in the global scenario. See, in India, we need not have to prove about Ayurveda. Everybody trust Ayurveda, and we have our ancestors who have already used, and we still use some of the household remedies for the treatments. But to give this, to spread this knowledge to the world, we need to have some scientific validation that Ayurveda actually works without giving any side effects. So for all of them, we need to have documentation, and the research has to be published in the national and international journals. And there are many scattered evidences for the safety and efficacy of Ayurvedic drugs, lying with many practitioners and researchers and non-governmental bodies. And how do we progress in the modern herbal research? There are some institutes which help us in this regard. Those are National Institute for Tropical Medicine, ICMR, that is Indian Medical Research, Council for Medical Research, and CDRI, Central Drug Research Institute, which help us in screening of medicinal plants for their biological activity. From 1963 to 1975, the screening have been done, and almost 2,000 plants have been screened till now. And apart from all these organizations, we have Ministry of Ayush, which will help us to improve our knowledge, to improve the research in modern herbal research. And why is it necessary to carry out this research in Ayurveda? Why can't we just, documented proofs, or why can't we just take the oldest information about Ayurveda and carry it forward? As I discussed, Ayurveda doesn't have any proper standardization techniques like pharmacokinetic or pharmacodynamic studies have not been done on the Ayurvedic formulations. That is the reason it is not trusted by Indians itself first on the first level, and we cannot, convince the foreign countries to use Ayurveda. So when we carry out research, it has to be published. The reason for this is to globalize Ayurveda, Ayurvedic knowledge, Ayurvedic formulations, principles involved in Ayurveda has to be spread to the world, and to increase the demand of evidence-based Ayurveda and industrialization of Ayurvedic drugs, to save the classical formulation, that is basic formulations, from losing their essence, to convince the users regarding safety and efficacy of the drugs, to carry out standardization, that is quality control of the crude drugs, both raw material and the finished products, and quality assurance of the drugs, to develop new drugs and formulations, to develop new indications, to explain and increase the understanding of the fundamental principles of Ayurveda. And why do we need to carry out clinical trials in this? Clinical trials are
Excuse me,
for
ma'am. Still
Ayurvedic
slides
drugs.
are not moving, ma'am.
Again, okay. Now,
Yeah. Okay.
okay. So let's keep like this, ma'am, to
Okay.
avoid. Okay, for clinical trials for allopathic drug, it is mandatory for the drug to undergo clinical trials before it gets into the market. But for Ayurveda, we do not have any such stringent rules that clinical trials have to be passed. Then it is transferred to the outside market. So here, the reason for this one, because already there are some formulations in the market. Ayurvedic formulations have to be tested in the lab, both preclinical and clinical, then they have to be sold to the market. So this strategy of testing the Ayurvedic formulations which are already prepared previously, which are already there in the documentation in our ancient books, has to be tested for their biological activity, and this is called as reverse pharmacology, revalidation of facts which are already documented in Ayurvedic books or treatises, to establish dose, duration, indication, and side effect profile of any given crude drug, to find out better treatment modalities for the diseases, to find out newer sources, new raw materials for the rare drugs. See, some of the drugs which are already proven to have very potent uh, therapeutic activity are getting scared now. I mean, because of lack of reproduction of the plant, they are getting endangered. So such plants can be produced also, or else we can find any alternative for such plants, and to find a pharmacological basis of mode of action of such drugs, to standardize the treatment procedure scientifically. And there are some organizations which help us in Ayurvedic research. First is Central Council for Research in Ayurvedic Sciences, ICMR, and CDRI, Central Drug Research Institute, then AIMS, then NIMHANS, then DST, Department of Science and Technology, then CSIR, IGBI, that is Institute of Genomics and Integrative Biology, and some other universities like Banaras Hindu University and other institutes in Pune, which carry out research, which help us to carry out research. They are offering Ayurveda as a course. At the same time, like DST, CSIR, ICMR, they'll be providing funding for the people to carry out research in Ayurveda, research on the herbal plants, so that we can explore our own plants and spread the knowledge to the world. And what is the current status of Ayurvedic research today in India? It is almost 2,000 PG theses per year at various institutes, and hardly 200 research papers pertaining to these researchers are published per year in Ayurvedic journals. Over 100 PhD theses in faculties of Ayurveda, and rate of less than 50% is being published. And nearly only 50 PhD scholarships are available for Ayurveda. There are very less number of schemes which are providing funding for these Ayurveda and related herbal, Unani, and all these Ayush related funding resources are less. And although also people or the students who are interested to pursue their career in Ayurveda are very, very less, and the people who are pursuing the career, who are publishing their work, and the work which is being coming out is comparatively very less. So this is the current scenario. And these works, when they are being carried out, if they are carried out with authentication, like the identifying the raw material, identifying the authenticity of the plant material, then carrying out the work, and then carrying out all the pharmacovigilance and all, then it can be published in research. As we discussed, it can be published in some good quality journals. Otherwise, when they are not published in good quality journals, it is a question whether we have to depend on such research or not, whether we have to trust such research or not. Then the outcome of Ayurvedic researchers has not yet tickled to the use and benefit of students as well as the Ayurvedic practitioners. Ayurvedic knowledge promotion and boost is not taking place. See, nowhere we can see that Ayurveda is promoted. Even the people who are living nearby or in the villages or the rural, they are not promoting, they are not dependent on the Ayurveda, because as I said, lack of standardization techniques, and or say the people who are practicing Ayurveda have become declined nowadays. So we directly go to allopathy unless until we know that they have certain side effects. Those cannot be used on long term. We are not dependent on the natural medicine. So that has to be, that promotion has to be done. Interest in Ayurvedic research is not instilled properly in the students, and all research activities are done blindly by following the modern trends. We just blindly follow the thing. The research where Ayurveda is included, we have to include both Ayurveda and the modern, the technology to analyze, right? Standardization techniques which are applicable for allopathy can also be fused with Ayurveda, and then we can bring out a new Ayurvedic formulations which have the essence of Ayurveda, at the same time which can also comply with the current trends of quality control. No set guidelines available in Ayurveda to strengthen the knowledge of science. How do we solve these issues? There is a need for paradigm shift in the strategy and methodology of research. The way we carry out research in Ayurveda has to be changed many times, because Ayurveda is lying behind thousands of years, and allopathy has taken the conventional system of medicine nowadays. So to comply or to compete with the allopathic system of medicine, much research has to be carried out on Ayurveda in different folds, and then we can at least reach to the level of allopathy. So many-fold research requirement in Ayurveda, that is in the first one, the science of Ayurveda, and second one, it is for the therapeutics in Ayurveda. Third one, to improve the understanding of Ayurveda in light of newer basic sciences and convince the modern medical world regarding therapeutic efficacy of Ayurveda. This is a bit difficult because you need to convince the whole world that our ancient Ayurveda is much, much better than the allopathic system of medicine. For that, we need to have proofs, validated proofs, scientific proofs have to be there, documentation should be there, dosage should be there. So everything has to be there, has to be proved before we show it to the world. Ayurveda has to be studied and investigated as it is critically adapting an Ayurvedic approach in tune with its basic principles. So we have to have the basic principles, maintain the basic principles. At the same time, we need to compete with the modern medicine also, with using the technical tools, modern technical tools, which are used for the quality control of the allopathic drugs. However, the technical tools can be borrowed from the modern basic and biosciences. The strategy of research which nourishes the science of Ayurveda lies 2,500 years ago, and however, proving it scientific in the eyes of so-called modern medical fraternity, which is widely controlled by pharmaceutical industry. Okay, first thing before we go to the modern foreign countries, we need to first convince the pharmaceutical industry to use our own products, to use Ayurvedic formulations to carry out research on them, because we need to trust our system of medicine first, and then we can spread it to the other people. Convincing biomedical scientists who want only Ayurveda and without their Ayurvedists, that is the practitioners. See, we don't rely on the Ayurvedic practitioners because someone to trust on has to be educated and has to have their skills also. So Ayurvedic practitioners, although they are nowadays, they may be educated, but in the olden days they were not educated, and they do not have they just carry forward the knowledge which is spread to them from their ancestors. So nowadays, to convince the biomedical scientists, we need to have a Ayurvedic practitioner who is a degree holder in Ayurveda, who knows the principles, who knows how to apply the principles, at the same time having the skills in Ayurveda. Understanding the problems, like as I said, clinical research has to be done in Ayurveda, but what are the problems which are associated with clinical researchers in Ayurveda? Understanding of fundamental principles of Ayurveda, selection of subject, diagnostic approach. See, in Ayurveda, the method of diagnosis is completely different from the allopathic method. So Ayurveda doesn't take out blood or doesn't inject anything into the body. It will just look at the eyeballs or pulse rate, color of the body, color of the eyeballs, color of the lips, and say urine output or the stool output. And these are the diagnostic approaches different compared to the allopathy, where we are completely dependent on blood test and urine test, and also some scanning and all, where sometimes some dyes are induced into the body and then the body is scanned. So the diagnostic approach is totally different. So you need to understand how you can apply these principles of Ayurveda in the modern system. Use of quality of life parameters as assessment criteria as mentioned by Charaka Samhita. Dependency of researchers on symptomatology, that is symptoms, based on the symptoms. Generally, in Ayurveda, as I said, we will be treating based on the symptoms which the patient is being shown. So understanding of Ayurvedic classical terminology and their grading is very, very important before we carry out clinical research in this aspect. And how do we improve this Ayurvedic research? Create a consensual Ayurvedic research methodology suitable and useful for Ayurveda. We can take the principles of Ayurveda, we can take the methodologies, technical tools from the allopathic, and we can mix and prepare a protocol where you can have the essence of the natural medicine, and then those has to be done without the toxic materials can be removed and the dose can be managed, and then pharmacokinetics, pharmacodynamic and other studies can be done. And when you are bringing out an Ayurvedic formulation, it should be devoid of any side effect, and it should be proven with safety and efficacy. Encouragement of interdisciplinary research. So research should not be restricted to a particular area. You can involve your uh, persons who are from physics, chemistry, biotechnology, biochemistry, and all these people can come together and carry out research, because everyone has their own importance in the drug discovery. National grading system for Ayurvedic terminologies. Encouragement to pursue their career in Ayurveda. Encouraging the students to take Ayurveda as their career. We don't usually encourage students to get into Ayurveda or any of the systems of medicine apart from MBBS or apart from the allopathic system of medicine. So let's encourage our students to participate in this one, study Ayurveda, and then you can have, as I said, biomedical scientists need to have an educated Ayurvedic practitioner. Institution of yearly awards for publication of best Ayurvedic data, updation of in-house research journals. So this is very, very important. Research journals has to be improved. The quality of research journals have to improve. Now, the number of journals which are publishing research based out of Ayurveda has to increase, and the number of people who are publishing their data also has to increase. So the updating the knowledge, whatever we have used before 2500 years cannot be used now. So we have made some modifications to the basic theme, and that has to be reflected in the research journals also. Development of Ayurvedic pharma sector, upgradation of Ayurveda literature, combination of Ayurveda and Western culture, nothing but fusion of all these things. Ayurveda has to be mixed with pharma, Ayurveda can be mixed with Western medicine, and then we can come out with a new formulation which is acceptable both by Indians and other countries without any doubt. Global research requirements, lifestyle diseases, their prevention and management, pharmacological researchers in the field of known herbs. See, we already have knowledge on some of the drugs which are already there in the Ayurvedic pharmacopoeia or say herbal pharmacopoeia. For them also, they have some pharmacological activity, but we do not have proper evidence for their like dose and all are not properly done, and they are not properly published, properly documented. For known plants also we can carry out pharmacological research to know the dose of the drug and to know the profile of the drug. And we can also identify the unknown plants, and unknown plants can be investigated for various pharmacological activities. Research in the field of panchakarma and yoga. Panchakarma is nothing but bio purification. So as Ayurveda doesn't only treat the disease, it also purifies your soul. It treats your holistic approach also. I mean, it also approaches you in a holistic way where your mental peace can also be obtained. Study of local flora for Ayurvedic pharmacodynamics, like study of the plants which are available in the near to our places. Generally, some of the plants can be grown in a particular area, particular location. So those are area specific. So we can identify those plants and grow these plants. And if you see that it is very potent therapeutically potent drug, then you can cultivate the drug and export to other countries or the other states where its use is more, where it is not being cultivated, or where its cultivation is difficult. Research in the field of food technology to develop new food products from the herbs used in Ayurveda. Okay, Ayurveda can be mixed with food, which you can call it as nutraceuticals. You can develop in the form of nutraceuticals, which are easy to consume without any. So for medicine, you need to carry out these, or dose has to be kept in mind. But for foods, it is not like that. One such medicine is spirulina, which is a superfood, you can say, which is a nutraceutical, and which can be consumed every day as part of food, and which will improve your health, which can also prevent certain diseases if you are taking it on a daily basis. Research in the field of agriculture technology to grow the plants in their countries which are useful in Ayurveda. As we have discussed, the plants which are useful in Ayurveda, which have potent therapeutic activity, can be cultivated in our country when they are available. When our environment is suitable for the plant to grow in our country, we can cultivate, and this can be economically made useful also. Like we can tie up with some industries where you can supply your raw material continuously so that they can prepare the nutraceutical. There are many number of industries which are showing interest in the natural medicine nowadays. They are looking for the raw material, including dyes, colors, because hair colors, or for any color, we are solely dependent on the synthetic colors. So people are now showing interest on the natural dyes obtained from the plants, both for fabrics or food colors or any other role of application. Consideration of fundamental principles of Ayurveda while designing clinical trials. Consideration of doshic, uh, like body nature. Prakriti is nothing but nature. Mansik Prakriti, mental status, physical status, everything has to be checked. And consideration of variants of diseases, doshic variants of diseases, and those has to be considered. Administration timings, whether you are administering in the morning or in the afternoon or in the night, or before food or after food, everything has to be considered here, because the absorption of food depends on these kind of timings also, like whether you are taking it with food or without food, or before food or after food, all these matters. And patya is nothing but restriction of some of the foods or restriction of some of the habits. Like if you are smoking or alcoholic, when you are taking herbal medicine, you should stop taking them. Or sometimes when some of the medicines would not work with high fatty food, so we need to skip your non-veg meals when you are taking such medicine. So all this has to be considered when you are using Ayurveda. Dosages format and employment of proper medical statistician who can guide the sample size. Statistician is nothing but who will calculate the dose and give you the exact amount of dose which is required by the body, which is not toxic to the body. Consistent quality of product has to be checked, and proper description of SOP of the trial drugs. Sincere efforts required from all the agencies. All the agencies include here the Ayurvedic practitioners, the pharmaceutical industry, and the government, like Ministry of Ayush and other agencies which are providing funding to carry out research in Ayurveda, ICMR, CSIR, all these. Everyone together can keep their efforts to improve the quality of the drugs, because quality of the clinical trials or whatever we are investigating has to be a qualitative one. Like if you are not carrying out any of the clinical trial, if you are not carrying out the extraction properly, if anything, any step, if you are not carrying out, if you are not maintaining the quality, it will definitely affect the final product, finished product. So we need to have compliance with all the GMP, GAP, GCP guidelines, so that we'll have a quality product out. And these are the areas where clinical research is required. Diseases of national importance: malaria, filaria, goiter, thyroid goiter, TB, AIDS, and lifestyle disorders. These things we can, if you change your lifestyle, you can at least bring it to the normal. Hypertension, diabetes mellitus, cardiac diseases, obesity, OA, and allergic and autoimmune diseases, bronchial asthma, bronchitis, and metabolic and collagen diseases like rheumatoid arthritis, incurable and chronic. Which are incurable when we use allopathic medicine, can also be curable by the SCAM, that is complementary and alternative systems of medicine, rheumatoid arthritis, cancer, Alzheimer's disease, and degenerative and neurological diseases. Primary healthcare, health level management, pregnancy, pre and post care, everything has to be, see here it is very very important to focus on the quality, because your pre and postnatal care is very very important, and in such cases whatever the natural drugs, Ayurvedic drugs which you are instilling to the patient has to be with utmost care, because it can has an impact on the health of both mother and child. Better health achievement for general people. And these are the some of the resources, both electronic and book format, where you can get knowledge of the medicinal and aromatic plants which have this which are therapeutically potential. And there are few apps also which are recently uh, it's in the first see, these are the two portals which were launched on 3rd July 2021, that is Ayush Manuscript Advanced Repository and Research Management Information. You also have Sanjeevani app, which was already there earlier and which is updated, and third version is available, and it was launched on the 27th May 2021. See, all these are the data where you can get knowledge. You have websites, you have book formats, you have apps, wherever you want, you can Google and get the information about the plants which are used for certain diseases and how they can be used, and even dose also. And that's all. I hope I could question all your answers. Thank you.
Its future. I hope all got good information regarding Ayurveda, and with this session, we can hope in future Ayurveda will be good. So now it's time for questioning. Yeah. If anybody have questions, you can ask by posting also. Once again, thank you, ma'am.
Thank you.
Now it's time to welcome our next speaker, Dr. Kalpana ma'am. Dr. Kalpana ma'am is currently working as an assistant professor in the Department of Pharmacognosy from RBVRR College of Pharmacy, Hyderabad. She has 13 years of teaching experience, has completed her PhD from Usmania University. She has 3 patents, 7 research publications, and also 1 book got published. She has attended many national and international conferences and workshops. So, with this small introduction, now I welcome Dr. Kalpana ma'am to deliver a talk on digitalization and technology for Ayurveda. So, I request madam to take over the session.
Thank you, ma'am. Thank you for my introduction. Good morning, everyone. It's my privilege to present my talk on digitization and technology for the Ayurveda. Before going for my presentation, let me congratulate the respected patron T. Jaipal Reddy Garu and Principal Sir Rajshekhar Sir and the convener Sujata ma'am and Shweta ma'am and the entire organizing committee of St. Peter's Institute of Pharmaceutical Sciences for conducting Ayurvedic Day celebrations for Ayurvedic research and future perspectives. Thank you for giving me opportunities. So I shall express sincere gratitude for today's seminar, which will be going to be a very insightful and enriching interest onto the Ayurveda and future scope and the golden era of Ayurveda ahead after completion of this talk. Just I'm going to present my presentation. Give me a minute. Is it visible, ma'am?
Yes, ma'am.
Yes.
Can you keep a slideshow, ma'am?
Yeah, just I'm moving my slides.
Yeah, okay.
Where the slides are moving?
Yes, ma'am.
Okay. So before going to my session, already Santosha ma'am has given a brief introduction about the Ayurveda. Just I want to give the ancient times, whatever the origins of the Ayurveda. Just I will give a brief introduction. So Dhanvantari is an avatar of Vishnu. He is the Hindu god associated with the Ayurveda. And everybody knows that what is the Ayush or Ayur? It is a meaning of life or lifetime. Veda means it is a divine knowledge. So this is the just a brief concept and what are the functions of dosa. Everybody has a minimum knowledge on Vata, Pitta, Kapha. So this is about 8 ways how to diagnose the illness. So there are the different 8 ways to diagnose everybody's illness because no body, individual body is responding in a different way. So based upon these 8 ways only, the Ayurveda is going to perform. In 1885, physician taking pulse. Based on pulse only, they are going to decide the illness of the patients. So these are the different treatment. So in this treatment, I want to highlight only the two things, Lankana and Brahmana. So Lankana is nothing but is the depleting. Whatever the toxins are there in our body, just they are going to deplete all the toxins from the body by using different types of the methods. Nourishing means they are going to give additional supplements to make the body enrichment with all the vital nutrients. These are the treatment methods. And when we come to the origin of the Ayurveda, that dates back to the Vedic era because it is very ancient and most material relating to the health and diseases are available in Atharvana Veda. So our historians claim that Ayurveda is a part of Atharvana Veda and Rig Veda, which is also a earliest Veda. It is also mentions about diseases and medicinal plants. So when come to our philosophy, the avatarana of this Ayurveda comes from starting from Brahma, next coming to Prajapati, next Ashwini and Bharadwaja and Dhanvantari. So these two are the father of our Ayurvedas in a different way. Okay. And next, when coming to the philosophy of Ayurveda, we can have an perceptions how this Ayurveda coming to the picture because nowadays everybody is having a minimum knowledge on the Ayurveda, but we have to know the basic ancient knowledge how this has come into the picture. So they are the founders. These are the 6 founders for the philosophy of Ayurveda and how it is evolved. So here different perceptions are there. Sankhya, Naya, Vaisheshika, Mimamsa, Yoga, and Vedanta. So these are the different perceptions, and those are founded by different Maharshis Kapila, Gautama, Kanda, Jaimini, Patanjali, and Badranayana. So, based on these Maharshis' names, they founded few Ayurvedic colleges and universities in our India. Based upon them, the universities are available in our India and how this journey has coming to the picture of Ayurveda, starting from the Brahma and ending with this 16th century. So up to 16th century, the Ayurveda has evolved and that has deposited into the all whatever ancient books. So after 16th century, the synthetic chemistry has come into the picture. So little bit delay has come into the journey of the Ayurveda. And there is a need to re-evolve this Ayurveda nowadays. Okay. And next, this is the our famous Charaka. It is a statue that is present in Haridwar. So he has given most knowledge about divine Ayurveda. And our Maharshi Mahesh Yogi. So they have given their efforts to global introduction and global spreading of our Ayurveda knowledge throughout the world. So he has given his efforts in 1967 only. And when coming to our objective of Ayurveda, so we know all the basics of Ayurveda, but what is our objective? Why we have to improve our Ayurveda knowledge? Because the objective of Ayurveda is to sustain the health of a healthy person and cure a diseased person with a purpose to heal and to maintain the longevity of quality of life. Due to its broad spectrum, Ayurveda accepts all the healthcare disciplines and intervenes them into a plan of treatment of every individual. So, due to this broad spectrum, whatever the healthcare needs nowadays, we are following, everything comes under Ayurveda practice only. So, next coming to our main core topic of digitization of Ayurveda. What is the need for it? In Indian culture and literacy space, digitization is an interestingly a novel process nowadays. Although there has not been much growth in the past years, digitization is a gradually gaining momentum as a prestigious government libraries and cultural organizations are digitizing their shelves replete with ancient manuscripts. Here you can see the palm leaf manuscripts, how they are preserved in our libraries. So our government, the central government is actively participating to digitizing and preserving our ancient valuable manuscripts. There is a mission called the National Mission for Manuscripts, NAMAMI. It is established by Ministry of Tourism and Culture of Government of India, which describes the objectives of digitization as digital preservation of original ancient manuscripts for the future generations. They are promoting as well as increasing the accessibility of all original manuscripts for the researchers, scholars, creation of a digital library with a repository of rare significant manuscripts, and also a formulation of standard and procedure in order to carry out the digitization of the manuscript. There are many more scientists, they are still working on preserving our manuscripts. And one more institute, Indira Gandhi National Center for the Arts, IGNCA. It is situated in Delhi and which was launched in 1985 by late Prime Minister Sri Rajiv Gandhi. It has done a tremendous job in the preservation of art and culture since they began the digitization of the manuscripts only a few years ago. At present, India is believed to possess more than 5 million manuscripts in different languages carefully kept in various Indian and foreign institutions around the world. Here you can observe the TED, the picture, the diagram, whatever they have pictured onto the palm leaves. So almost we are losing our ancient knowledge. So they have to preserve a lot. Some of the most prominent Sanskrit manuscripts were received from Saraswati Bhavan Library, which is located at Varanasi. And it is in this library, there are 5,329 manuscript rolls are available today. Most of these manuscripts, when microfilmed, were already in a fragile condition as they were composed on palm leaves. Here on right side, you can see the palm leaves manuscripts and the beech tree leaves like Burja Patra. So left side image, you can see the Burja Patra manuscripts. So those are already in a fragile condition. We need to save these manuscripts have been preserved and are still protected with the continuous care. They are stored after properly wrapping them in a cloth, and medicines are regularly applied to the leaves for the prevention of the pest. Neem oil is usually smeared in between the palm leaves to prevent them from sticking to each other. These many precautions we have to take care. As IGNCA already had a huge repository of microfilms of manuscripts, they have directly digitized the microfilms instead of digitizing the original manuscripts. It is very better to convert them into a microfilms. As a matter of the fact, more than half of these manuscripts have already been digitized and categorized in the library by the reprography unit. The digitization of the microfilms is done by Cultural Informatics Library at IGNCA. Here you can see everything information nowadays available in a mobile in the form of apps. The microfilms are converted into a digital images using microfilm scanning equipment so that they can be accessed easily without a microfilm reader. Reprography unit at Kalanidhi Namami, which has been evolved in a project of direct digitization of original manuscript since 2004 and has already digitized many significant manuscripts. Here you can observe the greatest um, rapid evaluation and development in this digitization has started since from 2004. And here you can see this equipment. This is the digitization of the manuscripts by National Mission for Manuscripts. And one more library, the Sahitya Academy Library, which is one of the oldest and most reputable libraries in India, which will be starting the digitization of its collection of the books soon. Since the digitization of the manuscripts is not an older phenomenon in India, we can hope that in a few years, all the digitized manuscripts will be accessed by all by via internet. Even though in WhatsApp we can observe all the books like Bhagavad Gita, Mahabharata, Ramayanam, everything we can available in a links form. So that's what the development has come into the picture nowadays. This would be definitely make research easier and save time for the academicians who have to travel to the libraries and institutions that hold the digitized materials. The IGNCA has developed an elaborate online catalog for the digitized manuscripts and statistics, which are improving each day. But one must remember there is a long way to go to achieve complete digitization of all our Ayurveda manuscripts of India. So here you can see this is the high resolution scanner microscope. Those are useful for the scanning of our all fragile manuscripts. Next, recently, Indian Ministry of Ayush, they have MOU with embased digitalization extensively for the development, education, research in Ayush. Ayush described the identified digital initiatives under categories of healthcare information system, research database or library, academic sector, and information education and communication. Over all these four categories, there are a huge development is there. India's digital initiatives here, Ayush systems of medicine means we are not only concentrating on the Ayurveda, Siddha, and Unani systems are also coming into the picture for the information research academia at various levels. Here, the digital initiative categories are health information system. So here, like Ayush Suraksha, E-Aushadhi, Siddha app, and Trisaksha Kosha, E-Cherak. So these are all the systems and apps available to get more information for the upgradation of the health information system. Next category, research database library. In this library, this Dhara, E-Class, and Ayush Sanjeevani app, and Gratansa Mukhaya, and another Ayush Research Portal, and RMIIS, Research Management Information System. So that these are the different websites and apps are available to get the information related to our Ayurveda manuscripts, research database, and library. Next category, academic category. In the academic category, Ayush has launched Ayurveda e-learning portal and also Ayurveda inheritance of in India. Two different portals are available to get the information about the Ayurveda in the academic sector. Next sector, information education and communication, IEC. So in this, the Siddha NIS app, Naturopathy NIN app, and Yoga Locator. These are the new initiatives to get upgradation of our Ayurveda systems. The digital initiatives from the MOA were a key to reform the traditional systems of medicine, and they could, all these four categories, they could improve the education, quality of research, and accessibility of Ayush healthcare services. So next, coming to the tech. So up to here, we have discussed about the digitization, how this ancient information has come into the picture of digitization. Next, coming to the technology. Everybody knows what is the technology. So here we need to concentrate what technology need for our Ayurveda. Technology is an instrumental in the delivery of Ayurvedic healthcare services, standardization, drug control, and quality control. This Ayurveda, as an established ancient science of the life, it has its own way of presentation. As the time passes, the globalization and modernization is urgently needed to dissemination this traditional system of medicine. Why? Because due to the side effects of our synthetic chemicals and synthetic drugs, and also due to overgrowing of the pollution and the pesticidal food, and whatever the fast generation of the lifestyle nowadays, whatever we are facing day by day. In the era of this computer information technology may play a unique role in this task. As the time passes, the global scenario changes towards the digitalization in every field. Here, technology is nothing but digitalization. Ayurveda also not escaped from this effect. Hence, it is the need of the time to use the technology in the progression and dissemination of an Ayurveda. It helps to make accuracy, uniformity in the subject to establish on the scientific platform. As in the previous talk, Santosha ma'am has given, we cannot completely directly depend upon the Ayurveda practitioners, because we should know the accuracy and the uniformity of the subject, how we are using the doses, how we are going to give the medication to the consumers. So based upon this, here we need to match our technology with the Ayurveda. See, when Ayurveda meets technology, what happens? So there is a marriage between our most ancient Indian medicine system versus a very latest information technology. So see what happens when they both marry together. So there is an evolution of this software. Recently, it has come into the picture. This software was developed by NIIMH. Okay, it is located in the Hyderabad. The software named is Integrated Clinical Decision Support System, CDSS. So this is a very advanced software. It is deals with the some core team. That team is completely based upon the clinical decision makers team. It is based on the diagnosis, prognosis, treatment, evaluation, prevention. So based on all the systems, there is a going to be evaluation of the most accuracy and precise form of the prescriptions to the patients. So I'm going to give a brief introduction about this software. This is a software exclusively meant for the Ayurvedic doctors. It is being developed so that they do not deviate from the classical Ayurveda methods while treating patients, and also keeps them updated about the best medical practices. And first of all, it's kind digital tool that will make sure that Ayurveda doctors do not go wrong and also follow the prescribed treatment as per the ancient time. For each of the diseases, this software will guide the doctor in an investigation, diagnosis, even treatment of the patient in the most traditional manner. The technology in the clinical practice of Ayurveda. So this is, we are regarding it as a high-tech Ayurveda. Nowadays, mostly in Hyderabad, we are observing so many evolved hospitals, Ayurvedic hospitals in the high-tech level. So this comes into high-tech Ayurveda. So any medical science which requires knowledge for the diagnosis, medical or surgical procedures, treatment principles, and medicinal combinations, and technique for the medicinal preparations and administration. So based upon all these requirements, this high-tech Ayurveda, which is related with the patient safety, it is a subset of healthcare. Most of the practitioners and most of the healthcare systems, they are going to be concentrate on patient safety only. So here in this high-tech Ayurveda, this health information technology, which includes starting from simple charting to more advanced decision support, and also which is moves towards the integration with medical technology. So this technology is adapted or generated according to the need for diagnosis, management, and procedure, etc. So based upon these technologies, here Ayush department Research and Development Department launch information technology training program for the Ayush professionals. This training was covered by basic and deep research topics with hands-on practice of IT tools as an assistant. So the expert put there, when you go through this training, everybody who are the listeners here, so whatever students here, so they can go through this training program. So there is a much scope for the expertise in the field of the thoughts of bioinformatics, clinical trial management system, evidence-based medicine, data analysis, healthcare informatics, statistical software, method of writing research articles. And also for our scholars and PhD scholars and our professors, there is a much more knowledge we can gain on the publications, plagiarism, indexing of the journals, citations, search engine, Google Scholar, Google Patent, Science Direct, and Coherent Library, Scopus, PubMed, and MyExplore. It is in a mobile app which is available in a Play Store, and also PubMed Search and MOOC, that is a massive open online courses, data collection, data mining techniques. So these are all available, and they are going to train by this Ayush department. And they are going to concentrate on computing, software development, websites, database, and networking. The basic concept of these computer fundamentals, software, networking, internet, cloud, Google, browser server, data, database, these are all clarified by the teachers of the Center for Development of Advanced Computing Technology. So this course is available. So we can grab this opportunity to get more opportunities in the development of an Ayurveda. Companies, through their sophisticated, secured e-commerce platforms, they are connecting ND customers with the remotely located centers, thus helping them benefit from the therapies aimed at relaxation and rejuvenation. India and various other locations across the world, they are noticing a surge in the wellness industry, with international visitors getting allured by traditions and benefits of Ayurveda and yoga. The wellness industry in India is at its growth stage, and it is gradually gaining popularity among the customers. The industry has a lot of scope to flourish as the lifestyle of the people is demanding, as inclination towards the wellness sectors. And Ayurveda retreats, the yoga centers have been working hard to sustain and grow their businesses also. The wellness industry is highly fragmented with the centers spread across the world. Nowadays, everybody, we can observe so many wellness centers are established in Hyderabad, and not only in the Hyderabad, maximum of the cities over the India and in the outstates also available. Technology plays a critical important role in the connecting these centers with the consumer. Besides connecting the centers, one of the most challenging aspects of the delivering a quality wellness offering is customer engagement. So this technology can help boost our customer engagement as well. So here you can observe, this is a setup used for the giving wellness and also for the Panchakarma treatment for the patients in the Kerala. And when this technology, so up to now we have discussed about the technology, how it is evolving. So when this technology taking it is into the masses, so when it is into the masses, what happens? Technology has changed the living habits by bringing the health and wellness information to the houses and pockets of consumers. The platforms introduced to the reach customers use cutting edge technology, offer distinctive user experience with a consumer centric approach through the exciting roadmap in offering features that would help customers in planning their wellness smoothly according to their lifestyle, according to their time management. Mostly for the software people, software workers, they are going to plan their schedule, their wellness accordingly. With a focus on creating seamless experiences, these platforms bring together the end customer, wellness centers, and supply chain technologies across the cloud and also data platforms. So with this all the technology digitization, there are many uses. See here, on any services or product suppliers website, one can use the customer reviews and ratings onto the site. So that allows the comparison and select of whatever the product we need for our requirement. And a few websites also features on informative blog section. This helps customers make better and timely decision. That means they brief information about the product, how it is using, what are the uses, and what are the ingredients information also they are providing onto the label and also in the website. Based upon that, your customer can be easily select what they want. An area of digital development that has enormously improved the health and wellness industry in the mobile technology. So everybody has an idea about this mobile technology. The smartphone has revol- revolutionized how people monitor their lives. Health and fitness apps are some of the most widely used ones in the world nowadays. The ability to send the communication through the text and is another great way to make the programs accessible to all the consumers, users, and keep them engaged. Okay, so fitness apps also are available. Everyone is downloading that apps and they are keeping to be fit day by day. Communication and collaboration as well equally important with the consumer, and the companies have paid attention to these important aspects of connecting with the consumers through the various channels such as Instagram, Facebook, Snapchat, etc. And call center is another approach. It is in a sophisticated chat, and call centers also helps provide a personal touch to the customer. It is a vital for the wellness sector to effectively use engagement strategies and tailored communications that will be instrumental in driving higher wellness engagement results through the right use of the technology. Here you can observe the high-tech hospital which is located along with the call center facilities also. How to reinvent? So, how to reinvent? Because it is a most ancient Ayurveda technology, we have to reinvent into our integrated technology and digitization. So, how we have to do? So, for such things, our central government has been promoting the Indian traditional way of medication by conducting such festivals like Oja festival. This is the most effective way to reach to maximum the people, and a nature friendly method of the treatment among the masses. Completely by conducting such festivals for such celebrations, we can immediately spread the knowledge into the masses. First call of treatment worldwide. So this Voja festival has launched recently, that is the first call of the treatment worldwide, and to give the priority towards our Indian Ayurveda systems. There, the renowned Ayurvedic experts, researchers, practitioners has come into the picture. They all together voiced their opinion on critical issues in relation to the Ayurveda and its relevance in the modern healthcare systems. So, what is the main focus of these Oja festivals? They use the technology in the Ayurveda, and mainly the medicinal cannabis which is producing in our India. They are focusing on the production and export of cannabis in India, and emerging career opportunities for students and doctors, and how this Ayurveda can cure day-to-day lifestyle disorders, and also the future pain management. Because nowadays every person is every day they are suffering with the any type of the pain. So in future we have the huge management how to deal with this pain. So these festivals are going to focus on the pain management. This finally here about all these conducting of these festivals and promoters and some platforms, our e-government and digitization policy of the government advocates that all the citizen centric services should be made available in a digitized form. Ayush grid has been formed by the Ministry of Ayush to concentrate on this aspect, especially digitization in Ayurvedic healthcare systems. This digitization is very important for bringing transparency, standardization, drug control, quality control, decision support, and continuity of the care. So, by this way, I want to conclude digitization and technology. There is a urge need for the rapid adaptation of our integrated technology for strengthening of our ecosystems. By this all the efforts, by this all the information, I would like to take a personally spent a lot of time understanding the ancient Ayurvedic and herbal lifestyles that made me choose my career as an innovator and promoter of herbal products for the various needs. So, after all the series of the experimental trials and positive results, I am humble and honored to launch my Sukalpa Organics herbal products, keeping in mind of various day-to-day needs of a life of health conscious end users. If anybody interested, I would love to give my inputs about all the products, what are the ingredients I used, and what are the results, how the benefits to the body. Here, little brief introduction about these products. These are main motto is without use of synthetic preservatives. I made amla juice, which is a natural vitamin C supplement, and superfood, which is based on 18 premium herbs without any preservatives, which is used as a natural supplement. Thank you. Thank you for giving me this opportunity. Queries, please.
Thank you, ma'am. Am I audible, ma'am?
Yeah, you are audible now.
Thank you, madam, for your informative talk on digitization and technology on Ayurveda. Yeah, and also thank you so much for saying high-tech Ayurveda and how to save our traditional knowledge and ancient medicine through digitization and technology. Because nowadays all are moving behind the digitization, so all people will think that Ayurveda is an ancient medicine. So
Yeah,
this, I hope
absolutely.
this session will helpful and needful for all. And now it's time for questioning. If anybody have questions, you can ask by posting. Once again, thank you so much, ma'am. And
Thank you. Thank you, ma'am.
now I request Sujata ma'am to propose the vote of thanks.
Good afternoon to all. On behalf of SIPS, I feel immense pleasure to propose a vote of thanks on this webinar. I would like to give my special thanks to our beloved chairman, Sri C. Jaypal Reddy sir, for his support and guiding us in every new step. I want to express my sincere gratitude to today's eminent speakers, Dr. Santosha Madam and Dr. Kalpana Madam, for giving us such wonderful lectures and enlightening all of us about Ayurveda. And we sincerely grateful for your part in our event. I thank our principal, Dr. P. Rashekar. I would like thank Dr. Praveen for their continuous involvement and guidance throughout the webinar. I thank to all head of the departments and faculty members. I thank Nandu sir and Srikant sir for their technical support. Finally, my thank goes to all the participants who attend the webinar with great enthusiasm and made this event a great success. In the end, thank you one and all for being with us today. Thank you all.
Thank you, ma'am.